next person on our list is Jeffrey Gardere. Welcome.
Thank you so very much. And I know in the interest of time, I will speak as quickly as possible and hope everyone is safe getting home tonight or wherever you may be traveling. Good day, chairs. Good evening, members of the Public Health Committee. I'm a board-certified clinical psychologist and ordained minister and professor at a New York medical school. And I understand the concerns of the opposition who equate terminally ill adults who want the end-of-life care option of medical aid in dying with people who unfortunately take their life prematurely. But scientifically and factually, it is incorrect to equate terminally ill adults who want the end-of-life care option of medical aid in dying with people who unfortunately take their life prematurely. Many, if not all, considered to be incompetent at the time that happens, and that is certainly not what medical aid in dying. You must be cognitively competent. According to the American Psychological Association, they agree with me that these two terms are fundamentally different. As well, the American Association of Suicidology also argues medically and legally, physician aid in dying and suicide are conceptually different phenomena. But I want to discuss something that perhaps we may not have touched upon with other speakers. I teach about lifelong healthcare disparities that we're all aware of for Black and Brown communities. We don't talk enough about these end-of-life healthcare disparities. For example, versus whites, African Americans are far less likely to have completed an advanced directive. They are more likely to have their pain underestimated and undertreated as people of color. They are less likely to receive opioid analgesics. They are less likely to use palliative and hospice care and more likely to die in ICUs versus their white brothers and sisters. My concern is that by silencing or denying the need for medical aid in dying as an end-of-life treatment option for all people who qualify and are in need of it, we will create a stigma concerning conversations about death and dying, and that stigma will be even greater in the Black and Brown communities, where we already see that stigma, where they do not talk about death and dying. But just as seriously, cutting off conversations or equating suicide to medical aid in dying will not only exacerbate the end-of-life disparities that Black and Brown people already experience, but they will be made to suffer even more needlessly as part of a medical system that I am part of, where they are already suffering needlessly. So just to close, medical aid in dying must be made available for the people of Connecticut now. There will always be too many terminally ill dying people in Connecticut who are and will be unnecessarily suffering at the end of life. And many of those are people of color who are already victims of substandard care and health disparities from the beginning to the end of life. And the reality is that there are too many terminally ill adults from every race, religion, gender, and attractionality who passed away advocating for passage of this law. We owe it to all of them to provide an end-of-life care option that offers peace and comfort. The time to pass the bill is now. And I thank you so very much, all of you, for your patience in my talk.
Thank you so much, Mr. Gardere. I'm glad you spoke, because I had heard somebody speak earlier and say that this issue is not of the minorities. I was hoping that somebody would be able to come and refute that. Could you expand on this a little bit so that we make sure that there's no confusion when we have more conversations?
Yes, there is absolutely no confusion in my mind and in my experience and what I teach in medical schools, that there are health disparities that Black and Brown people are experiencing. Now we see much of it is based upon implicit bias, not enough physician and healthcare provider training, but we see that the end of life healthcare disparities are very real with regard to palliative care and hospice care, and even not having the the information about medical aid in dying. If we kill this legislation, if we kill this information, as I said, we will see this as yet being another health disparity, another option that Black and brown people are not aware of. So this is a very real issue for people of color also.